Hello, my name is Maadarani, and today I'm going to present to you a newly discovered material in restorative dentistry. My pick for such topic is the material graphene. What is graphene? Graphene is a newly discovered material that caught the worldwide attention. It is a two-dimensional material with honeycomb lattice structure made of two carbon atoms that exist in a flat state on a substrate. Many studies were carried out to study the properties of such unique material and benefit from it in many fields, including the dental field. What are some properties of graphene? Graphene is the thinnest material known. It is an ultralight material. It is the strongest material, which is 100 times stronger than steel. And it's also known as a stiff material, also transparent, which absorbs only 2.3% of light. It is completely impermeable and with a large surface area. Another property of graphene is that it's the most stretchable crystal that has 20% elasticity and exceptional thermal conductivity and chemical stability. It has a great mechanical strength and it's biocompatible. Some physical properties of graphene. The thermal properties of graphene is that it has high in plane thermal conductivity due to covalent bond between carbon atoms. It also has high intrinsic thermal conductivity, so the addition of such material to composites enhances their thermal conductivity. The wettability and surface free energy of graphene. Graphene is a hydrophobic material, unlike graphene oxide, which makes graphene insoluble in water and saliva. Biological properties of graphene is that it's a biocompatible material with low toxicity, which is a great and important property for any dental material that is used. Optical properties of graphene is that it shows light absorption from ultraviolet to near-infrared. It contains pi electrons that allow energy transfer from the nearby molecules, leading to efficient fluorescence in quenching, which is the rapid way to bring the metal back to room temperature after heat treatment. Graphene in dentistry. Graphene in dentistry has an antibacterial effect. Graphene has a broad-spectrum antibacterial effect with minimal bacterial resistance and tolerable cytotoxic effect. It can be used in wound dressing, antibacterial packaging, and water disinfection, also as effective coating agent for dental implants. As you can see here, graphene has many uses in dentistry, graphene dental implants, and also other than dentistry, such as enhanced cell implant interaction, enhanced tissue implant interaction. Graphene used in periodontology. Graphene is very promising in regenerative dentistry. The use of titanium substrate coated with graphene has induced high proliferation of periodontal ligament stem cells and their differentiation into osteocementoblast-like cells. As you can see here, the introduction of graphene into teeth, it led to the regeneration of the periodontal ligament and to a healthy gum. The use of graphene in adhesive and dentistry. Graphene and its derivatives can be added to polymers to produce composites with enhanced physical and mechanical properties. The two-dimensional structure of graphene provides ceramic composites with enhanced interfacial adhesion between the phases, facilitates crack deflection, and improves fracture toughness. It can be added to adhesives, which increases their strength and give them an antibacterial property. These adhesives can be used in cementation of fiber posts without the fear of any leakage and with lower possibility for Streptococcus mutans incubation. They can also be used in the cementation of dental prostheses with lower risk of recurrent caries under the prosthesis. Hydroxyapatite combined to Ag graphene improve the mechanical property of composite, therefore composite core builds up as no possible with no fracture risk. As you can see here, there are some derivatives of graphene, which are graphite, carbon nanotube, graphene oxide, reduced graphene oxide. The use of graphene in another field in dentistry, which is endodontics. Endodontics, graphene silver composite nanoparticle solution can be used as alternatives to many root canals in irrigation, solutions based on its antimicrobial effect. The use of graphene in prosthodontics, being a two-dimensional material with incredible carrier mobility and superior mechanical strength, these highlight the possibility of adding graphene to polymethyl methacrylate for the fabrication of successful removable processes with increased hardness and wear resistance. This diagram shows some uses of graphene in dentistry, such as endodontics, restorative dentistry, periodontics, dental implant, and tissue engineering. As we know, many materials that are used in dentistry, they have many challenges and many disadvantages. But here the challenges that are facing graphene, although graphene has excellent physical, chemical, and mechanical properties, there is a challenge to modify and functionalize it without exhibiting acute or chronic toxicity. Another challenge facing graphene is the change in the nanostructure during biological examination without changing the physical and chemical properties. For this reason, chemical and physical characters should be done in the same environment. Some disadvantages of graphene is that graphene as a catalyst is susceptible to oxidative environments. And also, through its jagged edge, graphene penetrates the cell membrane and disrupts normal function. Another disadvantage is that it's super expensive. Finally, graphene is a promising material with unique physical, chemical, and mechanical properties. For this reason, many studies were carried out to introduce such material in the dental field to enhance the properties of many dental materials and to aid in tissue regeneration. Further studies should be done to overcome the challenges faced with graphene. Thank you. Hope you liked the material that I chose and hope that you enjoyed this presentation.